Welcome to Point by Point, conversations, interviews, and legal commentary for today's business professionals. Brought to you by Waller. As states begin to lift stay-at-home orders and businesses plan for reopening, OSHA is asking employers to develop response plans and procedures prior to employees returning to work. Aron Karabel, Steve Hawkins, and Mike Palmer offer practical tips for companies as they prepare their plans to help employees, customers, and clients stay safe in the midst of the COVID-19 pandemic.
This is Morgan Ribeiro, the host of Point by Point. With COVID-19 numbers beginning to stabilize in some areas of the country and some states announcing reopening dates, many employers are asking key questions such as what do we do to get ready and how do we do so without jeopardizing the safety of our workforce and our customers or our clients. Joining me today are Aron Karabel, a partner in Waller's Labor and Employment Group, Steve Hawkins, Deputy Commissioner of the Department of Labor and Workforce Development. And prior to his current role, Steve was the administrator of Tennessee OSHA for 8 years. And before that, he spent 12 years as the assistant administrator. And lastly, Mike Palmer, a principal at InSafe, where he provides oversight for all aspects of InSafe's consulting services, including OSHA-related trainings for the firm's clients. And both Steve and Mike bring to this conversation more than 3 decades of experience in this area. So we're really looking forward to the conversation. Always love when we have an opportunity to bring in outside experts as well as our own. So let's jump in. Governors, mayors, and other leaders across the country are lifting stay-at-home orders and beginning the reopening process. And there's a lot to consider during this process, and there's no way to fully predict the path forward for employers, regardless of their industry. But what do you recommend, Aron, for employers to review and to better understand before they begin to develop their reopening plans?
Morgan, that's a good question. Employers should first start, if they already haven't, reviewing federal, state, and local guidelines and executive orders. We know at a national level, the government wants reopening efforts to be in phases depending on the prevalence of COVID in the particular jurisdiction. We also know that governors are responsible for making the final determination on when and how to begin reopening. Some will follow the federal government's phased approach, some won't. It just depends on the jurisdiction you're in. Densely populated municipalities will likely have their own order, and employers need to consider those. It's unclear whether those orders will be aligned with state and federal guidelines. An example of that is in Texas. The state began protocols for reopening last week, but Austin has tightened its protocols, implementing strict face covering requirements. Employers should also consider sick leave policies. In certain jurisdictions, they've adopted employee-friendly policies, such as in LA, for individuals who are over 65 and have pre-existing conditions. They may be entitled to additional leave for COVID-related reasons. Lastly, employers are going to want to consider recent CDC guidance. In fact, hot off the press, and Mike can share a little bit about it, there has been some new guidance with respect to returning employees to work.
Yeah, Mike, I'd be interested, given your role and the work that you do with employers and clients across the U.S., your input on the new CDC guidelines.
Yeah, and that's commonly the first question. Everyone's very anxious to get back to work. Employers are very anxious from a financial standpoint, to get business going again. And as Aron stated, the first thing is employers got 2 things to determine right off the bat. You got to determine what phase you're in, depending upon the state and locality. 3 phases, but determine which phase you're in to start with. And the other is, what kind of employer are you? So there's certain restrictions based on the type of company and employer. And then you got to figure out which phase you're in. After that, you've got a determination of screening employees. So we can go into this in more detail later on, but basically you've got to determine if you've had people that have COVID symptoms and have tested positive, have COVID symptoms and haven't tested, ones that are vulnerable, ones that are not symptomatic at all. So there's actually different requirements depending on which one of those categories your employees fall into on them returning to work. The next part is kind of safely getting everyone back to work. And there's a lot of sub-elements to that. There's everything from temperature screening to safe restart that is COVID and non-COVID type concerns associated with getting people back to work and starting equipment and systems back up. Then there's an increased cleaning schedule and maybe a little different type of cleaning that needs to be done, especially with common use areas that would need to be considered. And lastly, you got to plan for what's going to happen if somebody does become sick. How are you going to handle that? How are you going to report it? How are you going to get care for them? How are you going to determine other identified individuals? What are the actions to take to protect the people that are still there? So those are kind of the broad-based considerations employers got to take and really have a plan for before they ever start getting people back to work.
Great. And Steve, from your perspective, the Occupational Health and Safety Act requires employers to ensure their workplaces are free from recognized hazards that are causing or likely to cause death or physical harm. Has OSHA implemented new standards specifically for COVID-19? And if not, what can employers do to minimize employee concerns and, of course, avoid OSHA citations?
Morgan, OSHA hasn't taken any specific steps to issue an emergency standard. They have adopted guidelines from other sources. And so in the absence of other specific standards, OSHA always has the general duty clause that requires employers protect their employees from hazards that are recognized that are likely to cause serious physical harm or death. And so I don't think there's any escaping that general duty clause could apply to employers who decided to take no action to protect their employees from this disease. And so our advice would be to take action and to follow the CDC guidelines and to implement those. What to do is not hard to find. It has changed some, it continues to evolve, but it's not difficult to find out what to do. So employers can't just throw their hands up and say, well, I don't know what to do to protect my employees here. Go to the OSHA site, go to the CDC site, gather the information and put a plan together and implement that plan. And one thing I would like to encourage employers to do, you should not go about this thinking, I'm doing this to avoid OSHA coming to issue a citation. That's not why you're doing it. You're taking these actions to protect your employees and to keep them from being contaminated or exposed to this illness from their fellow employees or for some amount of virus that might be left on the surface. And so what those generally are, we all pretty well know because we've been seeing it on the media for months, and it's frequent cleaning of commonly touched surfaces with a disinfectant, usually 60% alcohol or more, frequent places to wash your hands and to use hand sanitizer, to social distance, to cover your face so that you're not exhaling on someone else, or if you sneeze or cough, you would cough on someone else or on a surface. It helps protect that. And so go get those guidelines, think about how you run your business, and then think about how you could implement these guidelines and still get your job done. Another thing, of course, if you have an employee that has symptoms, you would want to put them on sick leave, have them leave the facility, or if they were diagnosed especially, you wouldn't have them in the facility. So you want to make sure that that's clear to employees. And then lastly, I think it's really important for employers to stress to their employees how important it is to follow these guidelines when you're off the job so that you don't bring the virus back into the facility. So take these steps to protect your employees while they're at work and then encourage them to protect themselves off the job.
That's a really excellent point that I think maybe oftentimes gets overlooked as, once it's not happening on the side of the workplace, that it's not necessarily their responsibility. But I think that's really important right now. And in light of COVID-19, I've heard a number of times this sort of quote unquote good faith efforts. Can you address that? And has OSHA relaxed its standards?
So OSHA did issue some guidelines that most of the state OSHA programs will likely follow that says, if you've made good faith efforts to comply with annual standards like fit testing or annual hearing tests, that OSHA is going to grant a 3 month, and that's the number right now, extension of those, and to allow employers to comply and give them a reprieve from those requirements. I think the most important thing about that is, so what constitutes good faith effort? And we'll start on the extreme end. If you're going to have a vendor travel in from another state, I think it's good faith effort that we're not going to do that. We're not going to, travel restrictions being what they are, that if that's what it takes to comply, then you're not going to be able to do that. So you've made the good faith effort. And then on the opposite end of that is if you own all the equipment, it's sitting right there in your facility, and you can do it and maintain the CDC guidelines as far as separating yourself, then you probably should go ahead and do that. So if you happen to do your own hearing test, which almost no one does, you had the equipment there, I think OSHA would look for you to go ahead and do that on an annual basis. If it requires travel or bringing in outside personnel, I don't think OSHA is really asking you to go that far at this time. And personally, I would have liked to have seen them be more definitive with their information that they provided because they don't define what a good faith effort is. But I would say, at least in Tennessee, if you're bringing outside vendors in, it's not going to be necessary. And if you can't maintain the safe distances and meet the CDC requirements to do that, then we're not going to look for you to do that in the next 3 months.
Right. Yeah. I mean, it does feel like a somewhat gray area, but, as long as you're checking some of those boxes that you mentioned earlier in terms of keeping a clean workplace and providing your employees, access to all the necessary, whether or not it's hand washing, things like that. But I think, the good faith effort is a little unclear, but maybe if you follow those guidelines that are out there, that you more than likely are going to be okay.
If I can piggyback on that, and Steve makes an excellent point about kind of the ambiguity in the good faith effort. One of the things we're looking at the interim guidance from OSHA and some of the draft, the draft letters and citation is that OSHA really wants employers to be thoughtful about putting together policies and procedures that are effective and that safeguard workers, and then implement safe work practices, providing resources for employees, creating an environment for personal hygiene, social distancing, and they're not saying that we've got to make drastic changes to the infrastructure of an employer's building.
So switching gears here a little bit, some state and local governments have suggested their reopening orders may require that businesses develop written policies, especially around social distancing, before being allowed to reopen. So, Mike, I'm curious from your perspective, what should employers consider as they revamp their policies and procedures?
It's a really common question that we're getting right now from a lot of employers and clients and whatnot. And actually, it starts with right where Steve and Aron left off with their comments. It starts with there is so much information out there right now between CDC, OSHA, WHO organization. There's plenty of information out there, and there's no reason here to think that you got to reinvent the wheel or create something that's not already out there. It's basically consolidating that. And I'll give you let's start with the example of screening. What OSHA and your state's going to expect is that you be specific regarding your screening of employees. So as I said, for someone that's not been symptomatic of COVID, they can come back to work as soon as you meet that phase of your state's plan. But if someone has had symptoms they believe to be COVID, but they've not been tested, there's very specific criteria for that. They're supposed to be 7 days without symptoms. They're supposed to be at least 3 days since the symptoms have recovered from it, and not have any other types of symptoms other than fever. So if they had COVID and they've been tested and it's positive, there's a different criteria for them that they must have met, as well as criteria for vulnerable employees. So there's really specific criteria. That's the kind of thing that's got to be in an employer's policy or plan. Like, what specifically you're doing. And then temperature screening. If you're bringing employers back in, there needs to be something written specifically for what you're doing from temperature screening, be it area thermal imaging or non-contact thermometers that people are doing checks on. If somebody has a high temp, greater than 100.4, what specifically are you doing with that person? Are you sending them off to a clinic? Are you bringing them into a clinic? I mean, the guidance is send them away, but give them very specific guidance from a HR standpoint and from a legal standpoint of caring for them. If somebody gets in your facility and then has symptoms of being sick, right? Again, very specific written guidance of what you're going to do to handle that, what you're going to do to clean and disinfect that area, what you're going to do for identifying people they may have been in contact with, notification of those people that they may have been in contact with. So, the policies and procedures really go to what Steve said of looking at the CDC and OSHA guidance that's out there, looking at how it applies to you for your specific workplace, and then writing that into some form of a plan. And this can be very condensed and easy and simple type plan of what you're going to do for each phase. And then that includes the social distancing, as Steve mentioned, as far as separating work areas, promoting telework and non-essential travel, and then also the frequency and the type of materials you're cleaning, where you're cleaning, common surfaces and whatnot. So when you talk about a plan, kind of all those things got to be listed in some type of a plan where you've taken information out there and it's condensed.
So in some industries, there are quantitative fit tests. Can you speak more to that, Mike? I'm particularly interested in how those work in the context of particular industries such as manufacturing or healthcare.
Yeah, this is actually directly related to what Steve was just talking about good faith. So if I summarize the guidance that's out there from OSHA on quantitative fit tests, it would be those two words. You have to demonstrate a good faith effort. So what OSHA recognizes is there's a shortage of N95 respirators. There's a shortage of the supplies that you use to do a quantitative. So with the healthcare industry, they're a little bit more strict they really want to see that there's been a fit test of the person using a respirator, N95 or other air purifying respirator. They really want to see that if they can't be for that, it's they are wearing a similar model that is a similar fit, whatnot, and when they were fit tested for. But for the healthcare industry, they really, really want to see as much as possible that those people have been fit tested. For non-healthcare, they're a little bit more relaxed with their requirements. And there's memos that OSHA has put out on April 3rd, April 8th, and April 20th that gives specific guidance that I'm referring to. What they have relaxed a couple ways is in the fit test, they're saying they recognize that those supplies may not have been there, so you can use them only if it's really required that you wear them. So they really want you to use engineering controls and work practices like ventilation and wet work methods where you don't require respirators of N95 or better. Then if you have to use them, let's make sure we try to, with people that have already had fit tests and have that model respirator and whatnot. The other thing they've relaxed is the type of respirator. So before 1910-134 said you had to have a NIOSH approved respirator. They put out a memo April 8th that said it could be, they listed other international brands and basically called it a NIOSH equivalent type respirator. So if you can't get a hold of NIOSH approved respirators, please reference that list that OSHA put out, and you can use those other international types that are listed.
So even once public health and governmental officials determine it is safe for employees to return to work, employees may still be reluctant for a variety of reasons, or maybe want to come back to work even though they shouldn't. So for instance, some employers may have employees who are too scared to return to work, but on the other end of the spectrum, you may have employees who are considered vulnerable, such as those who are over 65, who want to return to work. So Steve, any advice on that and for employers who may be addressing employees in each of those scenarios?
Yes, Morgan, I want to just add to what Mike said. Mike pointed out that it was really important to develop a written plan. And while I know lots of employers probably think that's all OSHA ever says is you need a written plan, and everything has to be in writing. But honestly, for something as serious as we're facing here, the thing a written plan does is it lets you organize your thoughts, look at the CDC guidelines, and think about how you're going to apply them in all aspects of running your business. And so I think it's really important to start with developing a written plan. And then when you get that in place and you figure out a way to run the business and maintain these guidelines that the CDC has, I think it's super important to be honest with your employees and let them know that you've developed the plan, that you've taken the latest information from CDC into consideration, that you've found a way to apply that to your operations, and that you communicate that plan to your employees honestly. And then I can't stress this enough, and I think everyone knows this. Employees know what's important because management sends them all kind of clues. And the clues are not in memos. They're not in what somebody says. They're in what people do. And so if you develop a plan, you figure this out and you implement it well, employees are going to know that you've taken it seriously rather. And so if you do that, I think you'll see good results. If you slap together something and you buy a couple of bottles of sanitizer and you spray a little bit of the sanitizer around, and employees don't see that you're taking it seriously, then I think you're going to have a different result. A lot of those people are going to file complaints with OSHA, and frankly, they might have just refused to come to work. And so I think this is a great opportunity for employers to develop their plan and communicate it honestly and then execute it well. And I think they'll see good results. The other thing that's important, I think, is to hire qualified contractors to do your cleaning. So if you do have a person who reports that they have those symptoms or they've been tested positive, that you bring in a qualified contractor who performs the deep clean. If you're going to hire a contractor to come in and screen your employees, that you hire a qualified contractor who has their people well protected during that process. And so I really think that's going to be the key. At this point, it's not hard to know what to do. It's a little bit more difficult to see how to apply the recommendations to your business, and then to execute it well is probably the most important part, so that employees see that you really care and that you're taking all the steps that you can to keep them from contracting this virus while they're working.
I wanted to reiterate a couple points that Steve just made with a couple case examples. We've had a client contact us that all of a sudden had a couple people that tested positive COVID. They did not have a written plan in place. They really hadn't, they talked about it, but they really didn't have a plan in place. What they're going to do if they did have a positive case come up. They had to scramble and find a company to come in and do the cleaning and disinfection. They had to scramble and decide how they were going to communicate that to the rest of the workforce, how they were going to get that word out, how they were going to identify people that had been in contact with a person over the last 2 days. They were just jumping, and they did a great job of it, but they were completely reactive. I had another client that had a plan a month ago that we had worked with them on and detailed very specifically what they're going to do for people coming in the plant. And then if they did have a positive case, they were able to deal with it in literally less than a couple hours because they had already had a plan. Now, did they have to adjust the plan a little bit? We always do. It's the same way, and Steve knows this very well from what he's seen as a regulator. Companies that are proactive in looking at potential contingencies like emergency plans, like fires and chemical releases and things of that nature, ones that have thought about it beforehand purposely and developed a plan for how they will react. They may not be able to follow the plan exactly, but at least it gives them a script by which to start with, and that helps them move through it very much, almost seamlessly.
And I wanted to share this just from a perspective of, going through, fire prevention training. It's interesting that not a lot of people know what to do when there is an emergency, unless they have been trained multiple times on who is responsible, where do I need to go, and what do I need to do? And those simple things, getting out of a building that is on fire, it requires a level of training and a level of understanding, in order to do it effectively. God forbid something happens.
I think that's something we can all relate to, right? Taking that fire drill seriously and paying attention, because you never know when that bad situation may occur. So, a couple of you have mentioned this, this instance of, all right, let's say that there is a positive COVID case in your workplace. For an employer, I'm wondering what instances are reportable and need to be entered into the quote unquote log. So maybe Steve or Mike, if you could address that.
So you do hear a lot of questions about posed to OSHA about if a person tests positive for COVID-19, do I put that on my log? And folks who are listening to these answers may not really like this one, but it really is going to vary from work location to work location. If you're a manufacturing firm and you have a single case in your facility and you don't have any others, and I wouldn't think most people would think that was work-related, a single case, or maybe two. But if you're a healthcare provider or you're in a position where you, like this recently happened with this meat packing plant, and they had over 300 people contract the disease, it might be hard to argue that that's not work-related. So employers will have to make a determination of whether they believe that exposure to the virus actually came from the work environment or not. Also want to stress that the log is not what makes your workplace safe, right? And so if you're going to have angst and worry about how good a job you're doing, keeping the facility clean in between shifts and what you're doing to separate your employees and keep the face coverings and do temperature testing and those kind of things. There'll be a lot of stuff that'll shake out in the months after this about what recording should be on the log. I would keep a record of all those. You can put them on the log, and if you get guidance later that it's not work-related or not to be counted as work-related, you can always line through those entries on your log. And so if I were a manufacturing firm, I wouldn't spend a lot of time worried about my log. I would spend all of my efforts trying to make sure that I was doing a good job cleaning between crews. Mike, do you have anything to add?
Yeah, I do. And I absolutely in support of what you just said. I think workplaces that have a preponderance of cases, that alone may not put you there, but if they're related, right? People in the same area, especially if you've not taken those good faith actions we've already talked about, right? So an employer that hasn't taken those good faith actions, social distancing, cleaning, disinfecting, screening, and are having a preponderance of cases, those are absolutely there. One that you may not mention or I may miss was if you're in the healthcare industry and you're treating a COVID, you're diagnosing or treating a COVID patient, and you contract COVID. OSHA's guidance on that for healthcare is those would be considered reportable as well.
Steve, going back to kind of what you were just covering, I'm curious, employees' fear for their health it's a real thing, and it really should be taken seriously. I read an article recently that said that Tennessee OSHA had received nearly 200 complaints in the last month from employees. How are those being handled, and how is that communicated back to employers? Are they made aware of these complaints that are coming through, and how do those get escalated?
So, Morgan, that's a great question. What our office is doing with employee complaints is we're handling those by letter. And so when we receive a complaint from an employee, we send the employer a letter. We ask them to respond to us within 5 days. And then when we get that response, we review the response, we share it with the employee, and then we make a determination at that point of whether or not to make an on-site inspection. I've always been amazed. I did this for a long time, and I was always amazed at how honest employers were when we sent that letter. Part of you might think, you send a letter, well, what is that? They'll just say they're doing it, and they're not. That's just really not been our experience. And so most of our letters have been very effective. And the response was, no, we have not been doing whatever that is, if it's cleaning or face coverings, but we will re-instruct our staff or instruct our staff to do so. And they send us a letter back. And most of the time, the employee is satisfied with the result. The most important thing for us is we have a limited number of inspectors, and that is absolutely the fastest and least as far as exposing our employees or your employees to our employees. That's the most effective way for us to handle those. And so the vast, vast majority will be handled by letter to the employer.
Aron, I know that our labor and employment attorneys have been fielding a lot of questions over the last few weeks, and this is moving so rapidly. But there are probably a few frequent questions that I think your team is getting right now, including requirements that exist around employer reporting of COVID cases amongst employees, and then also patient privacy. If an employee does test positive for COVID-19, how does that get communicated with the rest of the workplace, the rest of your company, particularly those that could potentially be directly affected? So I'd love to get your input on that and things that employers should be thinking about from a legal standpoint.
Morgan, good question. Employers are genuinely concerned and worried about their employees' safety. That's been reflected in the questions that we've received. With that, they're worried about their legal exposure while trying to normalize their business operations. Questions that have come up include things like, what if someone gets sick after returning to work, or worse, dies from the exposure at work? What do we do? How do we account for that risk? How do we ensure that our workplace is sufficiently protected? Other types of questions that we've been asked is, what type of insurance would cover our exposure, and can we require employees to sign certain types of waivers with respect to taking on risk associated with coming back to work? Other questions, just like you had said, include, how do we protect employee confidentiality? Many of these questions are complicated. They're fact specific. They require a review of current policies and practices. Again, as Mike and Steve said before, it requires our good faith efforts to protect our employees and being mindful about the latest guidance. For example, you've got the EEOC that has put out guidance last week on confidentiality of medical information with respect to employee testing. They have made it clear that you can take temperature testing, but the information that you gather from those tests, that's confidential. Now, juxtapose that to a situation where you have an employee that has tested positive for COVID or has symptoms of COVID, and you have to tell your employees who they were in contact. You're inevitably going to disclose the individual who had the symptoms or who had the diagnosis. So balancing protecting employees' confidentiality with employee safety, colleague safety, is something that employers are going to have to do, and it's going to be a case-by-case basis and fairly fact-specific. Another question that employers have asked is if employees do not want to return to work because they're either afraid or have pre-existing conditions placing them in a higher risk category, or have a parent or child in a high risk category, what do we do? And it's important to run a couple of traps. Of course, kind of reach out to counsel if the question it necessitates it, but you want to look at whether or not accommodations can be made under the Americans with Disabilities Act without creating an undue hardship on your operations. You want to look at whether or not FMLA is available for a serious health condition. If you fall within the Family First Act or the CARES Act, there may be some additional leave requirements that you have to provide employees. Also, look at your policies with respect to sick leave and whether or not local or state sick leave policies differ or give up an additional benefit. Ultimately, again, you have to determine whether or not someone should come back to work, or you need to make some type of an accommodation to allow them to either work from home or take some type of paid or unpaid leave if they genuinely shouldn't be at work and have a higher risk factor. The flip side is for those employees who have just refused to come to work because they want to collect more unemployment. I can definitively say that if there is a job available and we offer that job, an employee is not entitled to unemployment if there is an available job that they can do and they just want to kind of sit at home and eat potato chips on the couch. Lastly, if an employee wants to come to work, but there are factors that place them in the high risk category, that is more complicated because you certainly don't want to treat them differently on the basis of those high risk factors. You don't want to treat them differently based on their age, but you also want to ensure there are protections in the workplace should they come back to work.
So this conversation has been really helpful as we think about how to address the COVID-19 concerns, reopening of businesses, handling employees and keeping them socially distant and keeping the workplace clean. But from a bigger picture standpoint, obviously, non-COVID-19 related, what can employers do to bring people back to work? If you're working in a factory or if you're working in a healthcare setting, what are things more generally that employers can do to ensure that this reopening process goes smoothly?
Yeah, again, great question, because it is so easy to be myopically focused on COVID and COVID alone that people miss all the other hazards out there. There's a couple of really key things here. COVID, precautions and concerns aside. One is training and communication, right? So when people are coming back to work, we've got to be very, very, very clear with them on all the considerations they should be looking at. We're not used to a couple different things here, right? We're not used to, most people aren't, sitting at home for a couple months. So you got to think about what challenges that could present. I'm sure we've got those people that, were hashtag better version when they were off for 2 months and come back brighter and smarter and stronger than they ever. But we probably also have those people that haven't moved off the couch and have watched every Netflix movie there was. So we got to take that into consideration, bringing people back into the workplace. We got to look at everything from soft tissue injuries, from people doing tasks that they aren't used to doing. It could be bending, stretching, lifting, pushing, pulling, carrying. But what type of tasks are they going to workplace can be doing that? You got to look at machinery that may have been idle. So everything from cranes and hoists that have been sitting idle, especially with wire rope, to chemical systems, to machines that need lubrication. I would get my maintenance team right off the bat looking at restarting of equipment safely and looking at the PM requirements for that. The process safety standard specifically has guidance for restart after shutdown that employers should follow if they've got hazardous chemical systems. And then just a list of training. The best thing probably to do is have supervisors go over with employees the routine job steps, hazards, and safety precautions, non-COVID, just to remind people of what those things are. Almost kind of treat it like a new hire orientation or what you would do after a long shutdown. I think those are just very, very critical things. And then integrating those in with social distancing and being creative, how we're dealing with COVID and non-COVID.
Great. Steve, from a regulatory standpoint, anything you would add to that?
No, just that I think exactly what Mike said is true. You don't want to spend all your time on the COVID-19 cleaning and protocols and ignore the other parts of running your business safely, because they're really important. And so while you got to stress those, it's just an added thing. It's not in lieu of the others. And I think Mike's got an excellent point. People who have been off work for several weeks now may not have done anything but sit on the couch and eat potato chips. And I won't say why I know that might be the case, but let's just say if I was going to come back to work and do physical labor, I would probably need a little acclimation period, because I've watched McMillions and every other Netflix thing every night. So thank God for the internet. But I think Mike has a good point. You might need to consider, depending on the job, having some increased physical activity in the days before you try to bring people back. So that's a great point, Mike.
One thing I think I'd add to that, I think one of the challenges, and I already know a company that's kind of increased their workforce and seen this, most part we're social creatures. There are those that don't want to be social creatures. For the most part, we are. And one of the things that I enjoy about being around manufacturing and industrial environments is there's a great camaraderie that you see inside these facilities. So people are going to be really, really inclined and tempted to gather. And the way you've got to address that is you've got to physically change those gathering areas, right? You've got to, everything from your restrooms, your eating and break areas, you've got to not completely rely on human action to keep separate. You've got to physically separate things, stagger work shifts, stagger break times, so we have less people. So just like with anything from a safety protocols, we don't guard someone from the hazard of the machine by telling them, don't stick your hand here. We actually physically guard things to prevent people from doing that. That's the kind of creativity it's going to take as we return employees back to the workforce. I hate to say that, to keep them separate until we can let them come together. We're going to have to engineer it and develop administrative practices to keep people apart. Because I think it's a great thing that people want to be together, but we're going to have to really work at keeping them apart. And then face masks is the other thing. I think this is real, real important. CDC is very clear on that. Face masks, face covering should be on everyone, regardless if they're within 6 foot or not. Face covering on everyone that's in a workplace like that. And then if they can't wear a face covering, because we may find some that can't, we can look at things like face shields and alternatives, but only if they can't wear it.
So you have all provided some really good tips, some really practical advice during this conversation. But as we wrap up, I'm curious if there's anything, I'm an employer and I still need some clarity on some of these points. Anywhere you would point me to access additional resources?
Steve said it before, I think it was very poignant, and there is so much information out there. I would stick to, I guess, the reliable sources. There's so much information on the internet. Just kind of be careful what you're looking at, that it's been validated, it's scientific. There's some basis to it that it's developed for the public. So through your state, through the CDC, through regulators like OSHA, I think those are the most reliable sources to be looking at. Just be careful about anybody writing a blog or article out there, because there's plenty out there. I've seen some remedies that are just pretty amazing for what people should be doing for cleaning that have no basis to them. So just be careful about what you're looking at.
Thank you for listening to this episode of Point by Point, brought to you by Waller. Visit the News and Insights section of our website to listen to more episodes, subscribe to the podcast, find show notes, and more.